Let's talk about serving specifically Asian Americans and Pacific Islanders for mental health services. And to discuss this topic, I have Dr. DJ Ida. She is the executive director of the National Asian American Pacific Islander Mental Health Association. She has over 40 years of experience working with Asian American Pacific Islander communities. She received her doctorate in clinical psychology and helped establish numerous organizations, including the Asian American Educational Opportunity Program at the University of Colorado, the Asian Pacific Development Center, a specialty mental health clinic in Denver, and the National Asian American Pacific Islander Mental Health Association. She also has served on many advisory boards, and she has done a lot over those 40 years, a lot to mention. So you can find her full bio at AMPA's, the association's website. So I invite you to check that out. DJ, I'm so glad that you could join us today.
Thank you very much. I really appreciate this. And we have the longest acronym in the world, and it's actually with NAAPIMHA. It's actually NAPIMA, which nobody gets right. But anyway, if anybody's looking for it, the acronym is NAPIMA. But I really appreciate it. Very warm. Yes, NAPIMA.
NAPIMA.
It's a long one, but I really appreciate it. Very, very warm. And I think if you've been around this long, hopefully you've done something after all those years. But thank you very much for this invitation.
Yeah, well, thank you. And thank you for your time. So yeah, I really want to hear, NAPIMA's mission and vision. Right. So you're the founder of the association, is that right?
Yeah. Yes.
Yeah. So what brought that about? Like where'd that motivation come from, that drive? What were you hoping to accomplish?
Right. When I say that, I quote unquote established it, this really was very much a collective effort. And it was based on literally working in the community for many, many, many years. And one of the things that we're seeing is, one of the very first things that NAPIMA did is we started a curriculum called Growing Our Own. But a lot of it was, many of us, well, in fact, all of us had gotten our PhDs, gotten our MSWs, had really been through the system because there was a need to want to provide services. And we're seeing that our communities were not getting services that really met the very diverse need of Asian American Pacific Islanders. There is no such thing as Asian American. I mean, it really is, it's like the diversity. And so we felt there's a real need to be able to sort of pull all of our efforts together. And that was the reason really what started is many of us had received federal grants. And so I'd see my partners in DC for the grantees meeting. And then the next year, maybe some of us weren't there. And it was an issue. You got to be at the table if you got the funds. If you didn't get the funds, you didn't get to be at the table. And so there was a real need for us to just find a concerted effort to be able to address a lot of the needs. So that was sort of the starting point of what got NAPIMA started. So a bunch of us got together and said, we need to do something about this.
Yeah. And what were those specific needs that you were wanting to address?
When, even though, and I'm very grateful and I'm really glad that I got my degree, but on the other hand, all of us experienced the same things, that the training that we got was not complete. You would get literally a 1-hour seminar. And because I was one of the 2 people of color in my program, it's like, okay, DJ, you're going to talk to classmates about what it is to provide culturally competent services. And I'm thinking, who's going to train me? And it's like, I want my tuition back. If I'm teaching you guys, I get my
That's right. Back. That's right.
And then we're also looking at, and this is something which has held true for many, many years, but it's the way that we're trained can be very helpful and very powerful doing talk therapy. But working in the community, we learn so many other things. It's not the only way to heal. And that's really what NAPIMA has been focusing on, is workforce development. And throughout this discussion, we'll be talking a little bit more about the kinds of things we're doing, the issues that we're seeing. But it really was going back to the community and saying what works, what doesn't work. And it's also recognizing the profound differences. If you have a 4th or 5th generation biracial Asian American who's half Japanese, half Caucasian, their experiences can be radically different from a refugee from Cambodia, Laos, Vietnam. We're looking at the Bhutanese. We're looking at all these other communities. We're looking at the difference between an immigrant, a refugee, and then if you look at Native Hawaiians and Pacific Islanders, people who've been colonized. So just this global Asian Americans, Pacific Islanders, really, really didn't cut it. And we thought there was a need for us to be able to draw on the wisdom of the community to say, how do we change what we're doing? And it's, you don't throw the baby out with the bathwater and say, talk therapy is all bad. It's not, but it's not the only way to do things. And it's a battle that we've been dealing with for decades, and we continue to work on. So that really is the mission of, as what is the mission? It's to improve the health and mental health of Asian American, Native and Pacific Islanders, recognizing the impact of mental health on the community's overall health. It's just sort of the global purpose of why we exist.
Yeah. Okay. So this is how I understand what you said, is that in your graduate program, in your PhD program, doctorate program, you had a course on cultural competency, or a 1 hour thing, right?
It was not a course, it was a 1 hour.
A 1 hour.
Exactly.
Okay.
Oh yeah, it was.
So, they weren't necessarily saying this is really important, because it wasn't even a full course. But you were, in your mind, you were saying, hey, this is really important.
Yeah.
And it doesn't exist. Like
Correct.
it's lacking, right? Okay, so it's really important that we do have cultural competence when working with Asian American, Pacific Islanders. It doesn't exist. And then also, what I am learning about providing treatment is not a full fit. It's not fitting well enough. So we might have to really kind of shift things a little bit in the foundations of what we're being trained to be able to be culturally competent, with the end goal being providing the best care that we can to Asian Americans and Pacific Islanders. And it's not being done out there. So I'm going to start an association to bring people together so we can hear from each other from all different cultures, and try to educate, inform, and ultimately kind of shift and bring a fuller perspective to the training programs for mental health clinicians.
And there's one thing everything you said was accurate. I would modify the one part. It does exist, but not enough. There are programs out in the community that have been doing incredibly wonderful work since the early 80s. When we started Asian Pacific Development Center, that was in 1980. You have RAMS Inc. in San Francisco, Asian Counseling Referral Service in Seattle. You've got AKI in San Jose, APFC, APDC. I mean, there are a bunch of these, but they were scattered. And even then, and one of the things we're seeing in COVID-19 is that they're stressed to the limit. And so there were organizations, there were services out there. That's where we drew on how we looked. It wasn't anything magic. It was just saying, okay, you've been doing this stuff for a really long time. We've known each other forever. What can we do to make change? So, and that the ones that were in San Francisco, in New York, in Boston, in Denver, in Salt Lake City, had been doing this work, kind of figuring it out along the way for quite some time, but there was no way to connect the dots. There was no way to be able to have a concerted voice if we're talking about policies. What are the things that we can do to affect systems changes to make sure that we can then get the resources back to the community who are doing the work to be able to really provide quality service for our communities? So it's much more than just getting a training or being able to just say, we need more people of color or bilingual into the system. We will never reduce disparities or get it to the level that we need if we stay narrow in our focus. So it really is taking a much broader approach. And it's something that none of us are going to fix in our lifetime. I think COVID-19 has seen to that one, but it really is raising, I think, the awareness, being able to talk to you, being able to sort of stretch our circle and having a broader reach. This is the way that hopefully we're going to be able to really affect change if we're going to look at true elimination of disparities. It's going to take an effort for all of us. Absolutely.
Yeah, and collaborating really helps make that happen.
Absolutely.
And it sounds like you were saying that there were organizations doing things, and a lot of organizations continue to work towards this mission, and some of them get funding and some don't. So pooling the resources, collaborating really helps get the mission done.
Correct.
Yeah. Yeah.
And then fighting for more money to
Yeah.
come down to not just, and I know this is not a discussion on policy, so I won't go down that particular road, but those are the kinds of issues that when we're really looking at improving the quality of care for all of our communities, those are the kinds of things that we can't ignore, because it really, and that's really what a part of NAPIMA's mission also is. How do we then try to work on policies? How do we ensure that as the money does flow down, that it increases the likelihood? And it's not to say just because you are an Asian serving organization, you should automatically get the funds. Because I think we also have a responsibility to make sure that whoever's getting the funds really is doing it. And so maybe there are those who are currently there doing excellent work, but others that aren't there yet. So what do we provide training to them to bring them into the stream so they can provide really culturally and linguistically competent services, so they can then qualify for funds that we've hopefully been able to get down the pipeline. So it's
Yeah.
a
And,
lot
and
going
how
on.
are you doing the policy work?
Yeah.
Yeah.
Very, very briefly, when the Affordable Care Act was passed, we were thrilled in the mental health arena, not just Asians, but across the board, that mental health was deemed one of the 10 essential benefits. And then when they put money into it, we thought, this is good. Money's coming down the pipeline for integrated care. Because we'd always separated, if you've got a stomach ache, you go see a physician. If you're really depressed, you go see, your therapist. Maybe the two have something to do with it, which is a much more culturally appropriate way of doing things. So we're thrilled with integrated care. All the mandated dollars go into the healthcare system. Hospitals, healthcare systems can provide very quality services, but their integrated care by definition and the way they implement it can and often is very, very different from the behavioral health organization that focuses primarily on mental health. So both sides needed to be trained on what true integrated care really looks like. So then the money wasn't going into mental health, even though mental health dollars were made available. So when we went to DC, we talked to Samson and others, we said, there's a real need to get money into behavioral health. They got demonstration programs, it went to behavioral health, but then it goes to states, and it was the large behavioral health organizations that got the funds. And once again, the community-based organization that works specific with Asian American Pacific Islanders, the Latino community, the African American, and the Native American communities were closed out by and large because we couldn't compete with the large ones. So then you go back and you say, it's not just behavioral health, but it's ethnic specific. Because when you walk into a place like APDC, ACRS, RAMS, pick an organization, when you walk in and you see Asians everywhere, you see the signs and languages, you know that you've got a clinician that's not just one person that speaks the language that's hired in a sea of non-Asians. The services for the general population could be excellent, but it does shift the quality, the sense that we heal in lots of different ways. And when you walk into an ethnic specific organization who has the capacity to sit down and share amongst themselves what's working with the refugee population, they continue to teach each other. That's why our focus really is strengthening that, but also bringing the allies, that because not every community is going to have the benefit of an ethnic specific. So that's why I think the kinds of trainings that you and I are talking about is how to bring clinicians in general in, how do you bring people to just even be aware of what the issues are and what can they do. What happens if you don't have a RAMS or an AKI or an APDC in your city, in your state? You can't just ignore the Asian American Pacific Islander communities. So I think that's why the more we get the word out about how we train, these are the kinds of things that I think make a lot of sense. But
this is really important to hear. I think if you're listening and you are involved in policy, involved in making these decisions, involved in writing RFPs, considering organizations that might get missed, that actually have a critical impact on the effectiveness of where that money goes. So looking at it with a, I guess, when these funds come out, yeah, large organizations usually are going to soak up those funds, and it might not, get to all the smaller organizations that specifically cater to the needs of specific cultures and groups of people that are super effective because they're very relevant. They have a lot of rapport with the community and helping meet those needs that are often missed. So that's very good to hear.
And I really appreciate it, because if people can go and you can talk to your elected officials to sort of raise the issue around there,
Mm.
because those are the ones that are going to sort of appropriate legislative, they're going to look at the legislation and then they're going to decide what money goes. Mental health, the only good thing about COVID-19 is it raised the issue about the importance of mental health. So Congress appropriated $3 billion and we were thrilled, but again, and we actually had a chance to talk to Secretary of the Senate's office, actually the Secretary himself via virtual, and the head of SAMHSA. They were very, very receptive. So this is what you want, is you want folks in power positions because they have a lot more power than me or anybody else in my position has got. But when they listen to our communities and they go, okay, this makes a lot of sense. So as we're doing that, they on a call, there's no way they can promise and say, okay, we're going to automatically give it to you. But if you just get those messages out there, then maybe with a collective effort, we can begin to do the trickle down so that it comes back to us. And then from the community up, we'll tell you what needs to be funded. So you get the money to us from the top down, we'll tell you who should get it and what it should look like. And then that's a collaborative effort.
Yeah, excellent. And so what's NAPIMA's vision? What are you hoping for, 5-10 years from now?
Yeah. Our vision, which it may or may not come true, but if we had a little wish, and in fact, I've got a call with the board this afternoon, is really we would love to have sort of a center of excellence, a national training center, because it takes a lot of resources to do this. One of the things that NAPIMA has always done is I'll write a grant. And if I write a grant, then I take the services and trainings to the community. That doesn't generate revenue for us. So my job has always been write the grant. Having cut my teeth from the community, I know the communities don't have a lot of money. So I can't charge them $11 million to do our training. But what that also means is if we can get a center and to be able to get the resources to put together, we've got friends and colleagues literally from around the country that we could pull together, the best and the brightest. It would be phenomenal if we had a place where we could actually have internships to be able to do the training that really has an opportunity for you not to do just a 1 day, a 3 day, or 5 day, but this sort of an ongoing communication. It's being able to get supervision. It's being able to share cases, things that are done at the different agencies that I mentioned, but to be able to pull those resources. The other thing that if you have a collective voice that what this can do, if I'm talking to my health advocates in West Hartford, Connecticut, they are probably some of the best trauma experts in the country on working with trauma survivors with the Cambodian community. They're in a small. But when they combine their efforts with what's happening in Long Beach, California, what's happening in Santa Ana, what's happening in Denver, Salt Lake, when you begin to do that, if you've got a national collective effort, and this is where it's been really hard to get the funding, but if we could do this, when you do is when you begin to collect all that data, then you've got critical mass. You can start to look at the research because they're always saying Asian Americans, Pacific Islanders don't have any problems because look, they're not showing up for services. They don't show up for services because they have little to access. Access is always talked about key to remaining disparities. What happens if you have nothing to access? Because of language, the providers there are not culturally competent, or there's not enough of them to provide the services, or you can't take time off from work to do it whenever you are. So this is the way that when we can broaden that, we can get not only PhDs and MDs, it's important that we get paraprofessionals and community members in there by doing and collecting the data. And this is one of the things that we're literally, as we're talking about, I'm hoping is going to happen, is to be able to do some real serious research to look at the effectiveness of one of our training programs, to be able to then go and say, we've got the data. We will show you, because if you get the data that generates the revenues, that allows you to then do the things to get more data with the end game of not anybody making money, but saying we now can really put back into our communities the resources that we need. And it's broadening the definition. So again, for the providers that are out there, congratulations. I'm glad you've got your degrees, and I'm sure you're all doing excellent work. But it's also really important to recognize that many of our experts are going to be community members. So just as providers need to be aware of and learn how to do culture competent services, our community members who are paraprofessionals may have the language and the cultural skills, but they may not necessarily understand ways to do clinical services. And it's that blending that the training needs to correct both ends. And then we can really make some real changes. And it's redefining how we provide services. Maybe talk therapy, could be gardening, going for a walk, could be
Yeah.
eating,
So the
lots of different ways.
Yeah, so the vision is to be a center of excellence where you have the funding to do research on what's effective for
Mhm,
specific communities and to provide training, and
mhm.
not just training, but also the ongoing supervision, consultation, the integration part of the learning
Absolutely.
for clinicians.
Absolutely.
Yeah.
And these would be all clinicians. I mean, obviously, our primary focus would be on Asian American, Native and Pacific Islander clinicians.
Mhm.
But if we say that only Asian American Pacific Islanders get to work with our communities, the flip side is you only get to work with your own community. So to me, it's not hypocritical if I say we need ethnic specific organizations. Oh, and by the way, others can provide these services. It's not just who does it, but it's what you do and how you do it. And those are the kinds of things. That's what cultural competency is. Otherwise, it's tokenism. Well, you happen to be Japanese, so you can work with all Japanese. That's not true. And so those are the kinds of things what are the underlying dynamics? What are the questions that we ask? How do we ask it? When you work with an interpreter, what qualifies to be a good interpreter? There are all these different layers. But when we begin to address it at the systems level, we begin to really strengthen. And I also believe very strongly that when we look at diversity in all of its forms, everybody benefits. It's not just the community in question. So if we learn about the history of African Americans, it's not just for African Americans. We all benefit from what we learn from their experience, both the challenges they faced and what they brought, what they've did to make this better. Every single one of our communities has something to offer. And that's, to me, would be, how does the general population benefit by learning about Asian ways of thinking, conceptualizing, interacting, and doing things? And then because we're in the States, there's a blended model. So that, to me, is the value of cultural competency, sharing ideas, being able to learn from each other, and knowing what we can and what we can't do, and what our degrees, our backgrounds allows us to do. But sometimes what it can also do is blind us because we think we have the answers and I'll save you. So it's like, I think the community may have something to offer to this. And so we work in
Mhm.
partnership with that. We can do some really wonderful things, and it's happening. We just need
Mhm.
more of it. Just need a lot more of it.
Yeah, yeah, and I can see it being helpful where if an organization is working with a very specific culture,
Mhm,
um, being connected with other people that also work with that same culture and have found some
mhm.
success with different
Right.
things that they're doing, where they're connected. So, kind of being a resource center where, hey, we know this person over here that's
Yes.
doing similar work. Let's get
Mhm.
you guys connected, right? I think that would probably be very helpful. Um, can we talk a little bit about the successes of NAPIMA? So,
Mhm.
what successes have you had so far in achieving that mission?
Yeah. The most recent one, which is a small piece, but we're hoping is going to become much broader. This last May, we were we worked with Congressman Judy Chu's office, who is the chair of the Congressional Asian Pacific American Caucus, and she, Doris Matsui, and a number of other members of Congress. They put together a resolution, and this is the first time ever that a resolution was put before Congress to designate May 10th as National Asian American Native Hawaiian Pacific Islander Mental Health Day. And the intent that what we're looking at is not only is this a day to celebrate and then on the 11th we forget about it, it's to raise awareness that mental health is important and to redefine what mental health is. Mental health isn't just a diagnosable condition. Mental health is also celebrating who we are. It's being able to find the strength in our cultures, knowing that when you've got dance, you've got all these other things, this is how we heal. So if we can do this, then we're right now trying to find ways to have a really major blowout next May 10th to say, this is the first anniversary of a very, very important day, to thank members of Congress who pushed this forward, but then to also say from the policy end, these are the things we need to continue to do so that we can do all the kinds of programs we want to, after school programs, leadership training, going out and being able to get gardening, all these other things funded. But it's also just sort of a way for us to then highlight what's already occurred. So another one that we're really excited about We're developing, as we speak, it's a national leadership training. It's a mental health awareness training for Asian American, Native Hawaiian, Pacific Islander high school students. It's working with the next generation, and it's teaching them about what is mental health, what isn't it, why is it so hard to talk about, where does the stigma come, what are the cultural elements that keep us from really talking about mental health. It's redefining it. And then another part of it is just really looking at what is the impact of racism. What makes it hard for you to want to claim being Asian if by the more Asian you are, you're going to get the Kung flu and the China virus thrown at you. You're going to get all these racist comments, or that they're going to stop coming to your restaurant, or just the list goes on and on. You're going to get beat up on the streets of San Francisco. These are the kinds of things we need to look at. So when they can claim that we hopefully stop not racism against Asians, but all forms of oppression. And it could be sexism, it could be homophobia, it could be racism. Pick an issue that we really need to get back to a level of civility, humanity, and understanding we all benefit when we really look at what true diversity is all about. So work with the next generation for them to say, oh, and this too is mental health. It's not just about a diagnosable condition. It's being able to go out there and work in a neighborhood. It's cleaning up a yard so that it looks nice. You take pride in it because you live in, an economically disadvantaged area. That is some of the things. And so some of the trainings we've been able to do, we were able to work many years ago so that when SAMS was putting out funds, we were able to talk to them in that as a requirement for getting funded, you have to show cultural competency. And we saw the grants, people were saying, well, if you've got a Spanish speaking janitor in case of DB, we're going to do that. We pulled that grant real fast. And we said no. So then we went back. And so these are the behind the scenes kinds of things that nobody knows about, but we're really glad that we were there in those conversations to maybe at the systems level, in fact, so that if somebody's going to apply, they have to show if this is the population we're working with, how are you going to show that you're culturally competent? And it's that kind of thing that it seems like it's a small piece, but if you want to get funded, you have to show that you're competent and you can define what it is. So I think those are some of the things we're just really proud of. And if people want to go to our Asians in Focus, we give its own website. It's connected. It is a NAPIMA project, but Asians in Focus came about because I was really in a bad mood last year. It was because of the racism. And I've always wanted, and I've always believed in the healing power of art. And when I was doing the clinical work, I loved working with kids, and we used to use photography. So it was a way to say Asians in Focus, and it's literally the camera lens. That's what the focus is referring to. And it's the aperture. So instead of somebody else defining for us who we were as, and I won't, but whatever racist language you wanted to use, it's like, no, this is who we are. We will take the pictures of who we are in our words and our images. It's Asians in Focus. And so that's sort of an ongoing project. We are hoping we just finished out the first round, but we want to make this an ongoing, that we'll have Asian American, Native Hawaiian, Pacific Islanders submit their photos, and we're going to hopefully be able to expand on this and give out little small, it's not much, but if we can give a few $100 back to somebody, they can then sing it on an after school program or work with seniors. It's not the big ones, but it's that sense of I belong to a larger movement. That's my picture. That's this. That's that pride, a little bit at a time. And those are sometimes the best successes, not the big ones. I mean, I'd love it if somebody says, here's $11 million. That'd be a success. But that's no more than important than that 15-year-old that took that picture of his grandma, or a 90-year-old who took a picture going on a walk. Those are the things that we're really, really looking at. And for me, the joy is getting to work with community organizations around the country. It's not been easy. We've always struggled for resources, but I would not trade that for anything. That is the joy of working with the community. And they've taught me as much as hope they've given them something, but it's been a real treat. Loved it.
Excellent. And why should clinicians become a member?
Well, when we're looking at this, and it's not a membership organization per se, but being supporting it, it really is that if we can do more training, that they can take this message back. And so it could be in a private practice. It could be because mental health isn't just about, am I going to do a good session? Am I going to do that? But it's like, how do they support things within their own communities? How do they maybe take the lessons learned from this so that they can be an ally? So if you hear a racist comment, what can you do about it? You feel empowered. I have an understanding of this is, I do have the possibility of being able to impact change. It's being able to just say sort of collectively, if we're going to do a celebration next May 10th of 2022, 23, 24, they can be involved in that way by going out in their community and saying, what can we do to celebrate what it is diversity, including Asian American, Native and Pacific Islanders. So there's are a lot of things there that we really want to sort of build on to just sort of broaden people's, I think, their capacity to be able to participate. So if we've got an event going, that they will be a part of it that way. And again, with the training, is just, I think if people, the more people we get to recalibrate how they see cultural competency and the role that they can do, everybody adds a little bit something, and collectively that's a lot. It really is.
So if clinicians want to support NAPIMA,
Mm-hmm.
what they ought to do is go to NAPIMA's website,
Mm-hmm.
see what you're offering, see how it is that you're helping them as clinicians, learn something, and then actually implement it, do something, right? Have a May 11th event,
Mm-hmm.
take what you learned about being culturally competent for Asian Americans, Pacific Islanders,
Mm-hmm.
and implement it in the practices that you provide. Continue with the discussions, and right, that's how they
Absolutely.
can, yeah.
That absolutely would be, and maybe if they're interested within their own group of putting together something and asking us, we would do, I don't know how many sort of pro bono things, not
Mhm.
advertising, okay, we'll do it for free. But if there are resources that are out there, or if they just want somebody to kind of talk about what it is to work with the Asian community, just that kind of awareness to step, I'm not saying step out to the comfort zone, because they might be very comfortable, but they just don't know what to do. But just being willing to step out of the everyday thing and say, maybe we would like to learn a little bit more. Or do you know of some place? Because we've got on our website, and we're constantly updating it. But it's just, where can I go to? So if you're in Chicago, look it up and say, where do you go to there? So it's not just NAPIMA, because there's only so much that we can do. But maybe if we can help point them in the direction to work with a local organization, or they can start things. And there's, again, lots of ways. It would be really fun. And this is some of the thing that with our Asians in Focus, that we're trying to sort of build up, because it's a relatively new initiative. We would love submissions. What have you done in your community? Projects that maybe your youth have done. That what we want to really do is put sort of like this nice little gallery. We have a gallery up there right now, which is pictures we've done, but just sort of put up. And this is what's happening in St. Louis with their, and it doesn't have to be just Asians. It could be a multi-ethnic, but then part of it would be, and this is how we address Asian American, but it could be multicultural. That would be really a fun thing to do, because that's the kind of a sharing the projects. So those are ways that I think they can affect change. So it's not just what we're doing, but it's maybe kind of setting off in their mind, what can they do? And then if they're willing to share it with us, I'd be thrilled, absolutely thrilled.
I love it. I love it. Well, Dr. Ida, thank you so much for sharing with us. If you're listening right now, check out NAPIMA, their website, what they're doing currently, and continue to follow up with them. So thank you very much, Dr. Ida.
Thank you very much. I really, really appreciate this. Thank you.